Going out and having fun, enjoying each other's company and sharing good times can all provide us with some wonderful memories. But when substance use is involved in that undertaking, we need to be aware of what may be happening for those around us. Many of us have seen the effects on people who have overused a substance or maybe mixing substances while attending a party, a night out, a gig or some special occasion. So a question. What would you do if a mate or your partner or an associate who had been using a substance like alcohol suddenly became ill or incapable or unconscious due to that substance use? Scary thought. There are several steps you can take to help keep a mate safe in such circumstances. The first step is to recognise some of the signs of overdose. What does that look like? Well, when overdosed, the individual may be unconscious, slumped, and passed out. They may have blue lips, blue fingertips, or skin colouring. They may have very irregular or very slow breathing. It may be they cannot coordinate their movements and have floppy arms or legs, or are staggering. They may be making gurgling sounds, uncontrolled salivation, or dribbling. It may be they're unable to identify where they are, or just in a state of general confusion, or perhaps not responding to being touched, or not responding to sounds and voices. They may even undergo seizures or fits. These are just some of the indicators. So, you think your mate is experiencing what could be a case of overdose. What should you do? Keep the person calm, and if able to, safely guide them to a quiet area. If the person is unconscious, lay them on their side and tilt their head back to keep their airways clear. Call 000 for an ambulance right away. Do not put off making the call for help. Don't let others tell you they'll get over it or give them a few hours. Trust your gut, make the call. If you're concerned with the possibility of having to deal with the police, do not let this delay you making that call. When making the call, you only have to provide where you are, if the person is conscious or unconscious, and if the person is breathing or not breathing. However, by providing a name or your name, it can help the operator on the line talk more directly to you, help you manage any stress and anxiety you may be feeling, and facilitate possibly better outcomes for the situation at hand. Stay with the person until help arrives. If the operator is still on the line, it means they can be updated on the condition of the person and they can inform the paramedics of any changes while they're on their way. Also, a friendly voice can offer support and aid in keeping the person safe and calm. You can also provide more information to the paramedics when they arrive regarding what possible substances may or may not have been used in the lead up to the current situation. This can be critical information with regard to the paramedics delivering the most effective medical response. And as a last resort, use basic life support, CPR, if you're able. The ambulance online operator can also provide and support you through this procedure if needed. And just some don't do's. Don't walk the person about trying to wake them up. This can increase the absorption of the substance into the body. Don't try to make them drink coffee or other stimulants. It may also serve to increase the harm. Don't try to generate awareness by causing pain, by pinching or slapping or burning, as some substances significantly reduce these sensations. And don't douse the person in cold water or dunk their heads in an ice ski or cover them with ice. This can induce a shock reaction in their body, causing more harm. Learn to recognise the signs. Call 000 and don't delay, and stay with the person till help arrives. Let's keep our mates safe. For more information, see the links below.